So here's a question. Can you diagnose parasites from a blood test? The answer is not directly, but there are some markers that can give us an idea of whether there might be a parasitic infection present. So if we look here, we're looking again at my blood work, the report here. So if you look at this eosinophils level, so this is part of your white blood cell differential count. So eosinophils, you can see my percentage here is at 9%. That's definitely in the high range. You can see their range is 0 to 3. So we're definitely high there. So if that number is high, if your eosinophil level is elevated, that can be one sign that you do have an intestinal parasitic infection. There are a few other things that can make the eosinophils go up. So environmental allergies, food sensitivities, asthma, those kind of things can also cause high eosinophils. But if that level's that high, if that's elevated that much, that's a pretty good indicator that there could be a parasitic infection present. So based on patient symptoms and these levels gives us a pretty good idea. You can also do a stool test, but stool tests often miss the presence of parasites and they can be pretty expensive. So just based on your eosinophil levels and your symptoms, that can give us a pretty good idea of whether there's a parasite infection present. Also basophils here, this is another white blood cell count. If that's elevated, that can also be an indicator along with the eosinophils that there are parasites. So definitely not a direct measurement of whether there's a parasite present, but they can give us a pretty good idea here on a blood test.